My name is Andy. I'm a nurse.
And I'm Dr. Goyal. I'm a cardiac electrophysiologist. I'll be talking to you today about your condition and suggest some ways of managing it.
This video we're going to discuss with you about the Watchman device.
Hello again. My job now is to explain to you what a Watchman device is and why it's necessary. So here's a little cartoon picture of the heart, and as you can see, there are 4 chambers in the heart, 2 top chambers, 2 bottom chambers, and there is a little pocket that's attached to the left upper chamber of the heart, and we like to call it the left atrial appendage. Some people just say LAA, so that might be an easier way to remember it. It's the left atrial appendage, or LAA. It really doesn't do anything useful for you, but when you develop atrial fibrillation, you can get a blood clot in there. And if you do get a blood clot, that blood clot can then migrate up to your brain and give you a stroke. And that's never a good thing. So Watchman device is a little filter-like structure. So here's what a Watchman looks like. It goes in at the mouth of the pocket and has a little filter in it which blocks the blood clots from getting out of the left atrial appendage and going to your brain. So in patients who are unable to take blood thinners, there's a risk that you could get a blood clot in this area. And if it has a Watchman attached to that area, then the likelihood of that blood clot going to your brain is eliminated.
Well, to get ready for the procedure, we will be seeing you in the office, and it will be scheduled. And because of Medicare, we do have to have a second opinion. So you will need to see another doctor, and we will get that scheduled for you. You will have to be on a blood thinner prior to the procedure, and we will not stop that until the day of the procedure. So you will remain on your medication up until the time of the procedure.
So as Andy said, typically when you have surgery or any procedure, they would stop your blood thinners 2 or 3 days prior to the procedure. In most cases, we do not stop the blood thinners here prior to the procedure. Now this is different when you're on Coumadin. Let us instruct you specifically if you take Coumadin, but for all other blood thinners like Eliquis, Xarelto, Perdaxa, you continue taking it prior to the procedure. You would have to go to the hospital 1 to 2 days before the procedure to get some blood work and get some paperwork done. You will not know exactly what time to get to the hospital on the day of the procedure till 1 day before the procedure. That's when they look at the schedule, and the hospital will call you and give you instructions on what time to come in. The other thing to remember is if you are on any injections that are given for weight loss, then those need to be stopped 2 weeks prior to your procedure. We cannot give anesthesia if they are not stopped 2 weeks prior to the procedure. You should be fasting after midnight before the procedure, nothing to eat, nothing to drink. You can take a medication if you're supposed to take it with a sip of water. So now I'm going to tell you about what will happen when you arrive at the hospital. They'll get you ready. An anesthesiologist will see you, will perform this procedure under general anesthesia. Once everything is ready, you've been given general anesthesia, I'll put in a catheter in the right leg, in the groin, and go up into the heart. And we snake the Watchman device through a catheter into the heart where it needs to go. So if that's the LAA that we talked about, it will go and fit in there. It comes in different sizes because people come in different sizes. So you need the right size to fit in. Once we've done the procedure, we pull everything out and wake you up. Typically, the procedure can take anywhere from 30 minutes to 2 hours. It's different for different patients. Once you're done with the procedure, there's a special area we watch you. Make sure you've recovered well from the anesthesia. Make sure your groin isn't bleeding. And in about 3 to 4 hours, we get you up and walking. Typically, we will let you go home in about 6 hours after the procedure. Sometimes we may end up keeping you if the procedure went long or if I have any concerns. But even in those circumstances, you go home the next morning. So now I want to explain to you about how we manage blood thinners after your watchman procedure. The new guidelines suggest that we should stop your blood thinners after the procedure and put you on another blood thinner called Plavix or clopidogrel along with a baby aspirin. So if you've been taking Eliquis, Xarelto, Coumadin, those would ideally be stopped and you'd be switched to Plavix and baby aspirin. If you're not supposed to do that, we'll tell you, but otherwise this is what we plan to do with most of our patients. Understand a little bit about what a watchman is, how it'll be performed, what your experience is likely to be. The last thing I'd like to tell you about is a transesophageal echocardiogram, which is often called a TEE. That's a procedure where we take a close look at the watchman about 45 days afterwards. You go in the morning, register yourself, get ready for the procedure. It takes about 10 minutes to do this procedure. It's not painful. We give you sedatives, and we also spray the back of your throat to numb it, so when the probe goes down, it doesn't hurt. We do something like an endoscopy, where we put in a probe into your food pipe. We take pictures of the watchman.
One of the common questions I'm asked after a watchman implant is what happens to the left atrial appendage? Does it get filled up with blood clots? Where do those blood clots go then? The left atrial appendage is a redundant structure. It does not serve any useful function. After the watchman is placed, the tissue grows over the watchman and completely seals off the rest of the heart from the left atrial appendage. So it really doesn't matter if there are any blood clots in there because it's isolated from your circulation.
Hello, my name is Shatavia. I am Dr. Gold's scheduler. So if you need any appointments, any information about the procedures, you can call me at 352-751-3356, extension 3312.
Hi, my name is Veronica. I am Dr. Goyle's medical assistant. If you have any clinical questions Monday through Thursday, please call 352-598-5507. And any medical or clinical questions Friday, Saturday, or Sunday, you will need to call the main office at 352-751-3356.